Are you curious about alternatives to your medical regimen? In today's Q&A, we're diving into the growing trend of using methylene blue for various health concerns. But before you jump in, we'll uncover the risks, pitfalls, and what you need to know about supplements and over-the-counter drugs. Let's separate fact from fiction and help you make informed choices. Many people today are desperately searching for alternatives to the medical-industrial complex. All faith in our current medical system has been destroyed, and many are desperately searching for any trustworthy authority regarding their health, but it's difficult. I don't know anything about the current people pushing methylene blue, but it's all over the internet, and the claims are too good to be true. I wish so badly that I could just say, yes, any supplement is better than taking a prescription drug, but I can't. 13 years of my life, in addition to drug regulation, I conducted health fraud investigations. I used to do a bit of public speaking, and one of my presentations was entitled How to Spot a Quack. I don't remember the entire presentation, but I'm going to give you a few markers that throw up some red flags for you to do further validation of what is being presented. First, health fraudsters always provide a lot of very convincing bad medicine. I want to explain this a bit to you because seeing links to legitimate articles can often be what convinces us that something is effective and safe. Bad medicine is also referred to as cherry-picking scientific evidence or biased citation of research. Bad medicine refers to the deceptive use of scientific literature, where selective or incomplete medical research is presented to support a specific narrative, often for marketing, persuasion, or financial gain, while ignoring contradictory or more comprehensive evidence. This tactic is very common in alternative health marketing, pharmaceutical promotions, and even some medical debates where only favorable studies are cited to push a product or idea. So when someone screams that, "I follow the science," this can be true but also very harmful if they only follow the cherry-picked science. For instance, they may cite rat or dog studies and bioavailability, distribution, toxicity, and many other factors may not convert. Our body is made up of thousands of different chemicals and are not the same as ours. So animal studies simply do not automatically convert to human efficacy and safety. So recognizing bad science is very important. I hope that I have expressed how important it is to understand the full body of knowledge on any scientific topic. The second thing that I would tell people is that when looking at marketing, scams claim that a product doesn't work for one thing, but for everything. This is another red flag. I believe that energy healing requires less specificity, but due to the way that drugs work, when there are thousands of different types of cells in the body, there just isn't a one-size-fits-all drug. Next, scam products are always 100% safe. No side effects, and hate to be the bearer of bad news, but that doesn't exist. When somebody tells you there are no side effects, they are a liar. Then there is the hurry-up pressure because it's going to either run out or be pulled off the market. Those are just a couple things to look for. So everyone is running from bad medicine rubric and mandates issued by politicians who took millions from big pharma to unqualified non-professional entrepreneurs making a profit on selling you bad medicine. So we are going to focus today on an old-time drug called methylene blue. We are going to look at the potential side effects and why methylene blue dropped out of use in favor of big pharma substitutes. So today's question comes from at IamSully9010.
Hello, my friend. I trust how thorough your research is. Can you do a deep dive on methylene blue? It seems to have so many uses, including viruses. I am using it for cognition problems that I got as a result of the COVID years. I was forced to take the vax to keep my job. There's a lot more that methylene blue can do. I'd love to hear your thoughts. Thank you.
Hi, Sully. How you doing? Good to hear from you. Apparently sellers are pushing methylene blue now because a friend asked me this a couple of days ago, and I'm going to tell you the same as I tell those close to me. My guess is that some new study has been done, probably in animals, so it's spreading like wildfire, but that doesn't mean that it's safe in humans or rats. Methylene blue is available in both prescription and over-the-counter (OTC) forms, depending on its intended use and concentration. So it is a drug under FDA oversight. Prescription use are generally higher concentrations for treating methemoglobinemia, Alzheimer's research, or certain infections and requires prescription. However, in 30 years, I never dispensed one bottle of it. Lower concentrations are sometimes available OTC for uses like aquarium treatments, dye staining, or experimental nootropic purposes. Methylene blue has a lot of potential medicinal properties. The problem is that it has a very narrow therapeutic window. It can easily become toxic, and I'm not sure of the dosing on this, so you want to be very careful with the dosing. The second concern, which is related to the dose, is the manufacturing control. The product that my friend sent me a photo of was an industrial formulation. Most of it being distributed so it's not been tested for strength. Let me explain. If I make a 1% solution, I do it by putting 1 gm of a powder in 100 ml of liquid. Many things can affect solubility, and for this reason, drug manufacture requires post-production validation. It's kind of like buying heroin if you don't know how much it's been cut. That's why dealers test to be certain that they are getting a certain strength. Let me explain the definition of a narrow therapeutic window, or narrow therapeutic index. It refers to a small range between a drug's effective dose and its toxic dose. If the dose is too low, the drug may not work. If the dose is too high, it can cause serious side effects or toxicity. Drugs with a narrow therapeutic window require careful monitoring to ensure safe and effective use. They also require a very accurately prepared solution to make sure that there's not too much in it. Examples include warfarin, lithium, digoxin, and methylene blue. A narrow therapeutic index doesn't preclude use, but blood levels are generally taken on a regular basis to make sure that blood levels are therapeutic. Methylene blue toxicity can occur at high doses or with prolonged use at lower doses. It primarily affects the nervous system, cardiovascular system, and blood. Here are the potential risks. 1. Hematologic effects. Methemoglobinemia at high doses, which means the iron in hemoglobin is oxidized, reducing oxygen transport instead of fixing it. Hemolysis, which is the destruction of red blood cells. 2. Neurological effects. Confusion, dizziness, headaches, tremors or muscle spasms, and in severe cases, seizures. Serotonin syndrome can also occur if combined with SSRIs or other serotonergic drugs, with symptoms including agitation, high fever, and muscle rigidity. 3. Cardiovascular effects. Hypertension, which is high blood pressure, tachycardia, or fast heart rate, and chest pain, which is rare but possible in high doses. 4. Gastrointestinal effects. Nausea, vomiting, and diarrhea. 5. Skin and urinary effects, blue-green discoloration of urine, skin, and mucous membranes. If someone chooses to use methylene blue, treatment of toxicity involves discontinuing methylene blue, providing oxygen therapy and supportive care, and in severe cases, considering an exchange transfusion. So, these are always my concerns. As I said in one of my videos, I'd estimate that at least 50% of the drugs prescribed are due to a side effect. For instance, let's say someone experiences neurological effects as mentioned above. When the ambulance comes, they are going to hit you with a shot of some sort of benzodiazepine, Valium, Versed, etc., which could cause acute hypoxia, hypotension, and even shock. So then they give the person more drugs to counteract that response. We have become so comfortable with drug use that we never even consider the potential risks, even if it is obtained over the counter. Hydrogen peroxide is OTC, but if you drink it, you can burn up your insides. I also told my friend this. The anti-aging claims related to methylene blue have to do with mitochondrial stimulation, which exercise and other stuff does too. I generally like to keep my regimen as natural as possible because I've seen such bad stuff in supplement manufacturing facilities. Another basic rule I have is that if God put it on the earth, then it was designed with a purpose, often medicinal. If it's made in a lab, then it's not part of the original program. Methylene blue fell out of widespread medical use for several reasons, despite its effectiveness for various conditions. Over time, more specialized and targeted medications were developed that replaced methylene blue for specific conditions. For example, modern antimalarials, antidepressants, and antibiotics became more widely used with fewer side effects. Safety concerns and side effects is another reason why methylene blue was replaced with other drugs. Not only can it have serious side effects, but it can cause serious drug interactions, especially with SSRIs or selective serotonin reuptake inhibitors, which can lead to serotonin syndrome, which can be fatal. While methylene blue has various potential benefits, the FDA only approves it for specific conditions, such as methemoglobinemia and certain diagnostic procedures. Off-label use exists but lacks large-scale clinical trials, leading to caution in mainstream medicine. This is generally an issue when a drug like methylene blue's patent expires. There's just no incentive for drug manufacturers, so disuse occurs due to a lack of financial interest. Also, as mentioned above, purity is a major concern with industrial drugs. Pharmaceutical-grade methylene blue is different from industrial or aquarium grade, which can contain toxic additives. This is not true with all aquarium-grade drugs. In fact, some of the fish antibiotics are the exact same capsules that I dispense to people. But in general, industrial-grade chemicals are a risk. I know that many bulk chemicals come from China, and ingredient sourcing was always an issue when I worked in regulation. Regarding your concerns about having taken the vaccine for work, it depends on which vaccine you took and how many doses you had. From what I've heard, I believe the mRNA was the biggest problem due to the lipophilicity of the mRNA carrier, which allows the vaccine to enter every cell in your body because cells, including the brain, are surrounded by a lipid membrane. A well-known problem with all fat-soluble drugs is that they accumulate in the fat or lipids of the body, so I really think the key to detoxing is getting it out of the fat stores, so that the kidneys and liver can eliminate it. There are ways to remove drugs from fat, which we will discuss in the next section. A lipophilic or fat-soluble drug such as the mRNA vaccines accumulate in fat tissues and release slowly over time. To speed up elimination, the following strategies can help. First, increase metabolism and fat mobilization with exercise, specifically cardio plus strength training. Exercise burns fat, helping release stored drugs. Intermittent fasting or calorie deficit also promotes fat breakdown or lipolysis. Cold exposure is known as cryotherapy. Cold showers may enhance fat metabolism. Second, you can enhance detox pathways with hydration, which helps flush out metabolites through urine and sweat. These detox pathways include liver support. Consume cruciferous vegetables such as broccoli, cauliflower, and kale to enhance liver enzyme activation. You will also want to increase bile flow, which is done with fiber that binds toxins in bile and promotes excretion via the gut. Such products include bitter foods such as dandelion and artichoke, which stimulate bile production. You can also promote elimination through sweat and skin, such as using a sauna or hot baths, which encourages drug release via sweating. Dry brushing and massage also stimulate lymphatic drainage. Fourth, I'd optimize gut health and bowel movements with a high-fiber diet, which helps bind and eliminate fat-soluble toxins via feces. Lastly, medical interventions could include activated charcoal or cholestyramine, which binds some fat-soluble compounds in the gut. Personally, I would eat a high-fiber diet with a lot of greens, and I'd use activated charcoal to physically remove the toxins. The charcoal can be used for 1 to 2 weeks on, then take a break to avoid nutrient depletion. The dose is 500 milligrams to 1 gram up to twice per day, taken an hour before or 2 hours after meals or medications of any kind. Drink plenty of water to prevent constipation. I'd probably do this regimen for a month or two, 1 week on 1 week off. I will link an ozonated charcoal in the description, which is reported to enhance removal. There are prescription drugs such as cholestyramine, which can also pull drugs out of your fat stores, but you'll have a heck of a time convincing a doctor to prescribe it. As you can tell, I'm just not big on drugs and certainly not chronically. If you want to take methylene blue, I'd be very careful. I'd go low on the dose and go off of it every couple of weeks to minimize toxicity. Be aware of any twitching in your body, such as eye twitches, and discontinue it immediately. Personally, I don't take the risk. If it's not broke, I don't take drugs, and I use truly natural products for healing. Overall health, including cognitive health, is a result of a group of factors that all fit together. This delicate balance includes factors such as lifestyle, stress versus passion, food and exercise. It isn't one thing or another. It's a connection, an interaction, a symbiotic relationship with everything of God. That's my recipe for natural health. Thanks so much for the question, Sully. It's a good one, and I hope that helps clarify my thoughts on the topic. I will leave you with a quote from Hippocrates, the father of medicine. He said, "Nature itself is the best physician."